We are live now.
Good evening, delegates and participants. Thank you for joining Shield Collect. And today we are back with our hit series Icons in Conversation with Dr. Ritu. And today we have a special icon from Indore, Dr. Kavita Bapat ma'am. She is going to take a topic AI in obstetric and gynecology, which is very new topic in this webinar. So let me introduce Dr. Ritu ma'am as well as Dr. Kavita ma'am. So the organizer of this webinar is Dr. Ritu ma'am, Dr. Ritu Santwani ma'am. Ma'am is obstetrician and gynecologist, IVF specialist. Ma'am is founder and CEO of 360 Degrees Healthcare Studio and consultant at Inamdar Multi-Speciality Hospital from Pune. And ma'am is also infertility test tube baby specialist. Ma'am has also been part of NUHS from Singapore, co-founder of MAAM and board member of SWWC. And now let me welcome Dr. Kavita Bapat ma'am, who is icon for this today's topic. Ma'am has done MBBS, MS, FICOG. Ma'am is director of Bapat Hospital from Indore. Ma'am was a member, past vice president of Foxy. Ma'am is one-day hysterectomy specialist and ICOG vaginal surgery certificate course from center. So I welcome Dr. Kavita ma'am, as well as I will hand over session to Dr. Ritu ma'am for this very new topic, AI in OBGYN, that is obstetric and gynecology. Thank you, ma'am.
Yeah, thank you, Nishan. Thank you, Sayati. Thank you, Shield Pharma, for providing the platform tirelessly. We are doing this program for more than 1 year. And I welcome all the delegates who have joined all across the geography. Today, we are going to discuss, as we all know, this artificial intelligence has changed the entire world, is penetrated in each and every field. So today, none other than our own Dr. Kavita Bapat madam, we can say the queen of Indore. So madam is going to discuss with us that what's the role of AI in obs and gynec practice. Before we start the session, my best wishes to the madam. Madam is contesting for the president post this year. So friends, our request wholeheartedly support to madam and best wishes, ma'am, for your elections.
Thank you so
so friends, first we are going to start, we are going to listen to madam, and later on we can ask whatever the queries you are having.
Absolutely, absolutely. So thank you so much, Ritu. Always a friend in need and a friend always. The love and the way you are looking so great nowadays with all the ideas and everything you have put, and so good. I'm so impressed by you. So just sharing my presentation, I think it's visible. Am I right?
Yes, visible, ma'am.
Yeah, it's visible. Okay, so I'll make it large and I can talk about. So the topic is what the future is basically next 2040 or 2050. I think artificial intelligence will take over everything. I'm telling you, when we were students, kuch bhi nahi hota tha. Then gradually I have made one video also, ki sara ka sara office came into our mobile. Everything came into our mobile, all the apps, everything has been into the mobile. Now, in the next 10 years or 15 years, all the mobile things will come in our specs. So that will be the artificial intelligence that will clear everything and the things will be very simple. So it's the future and where we are in artificial intelligence as a OBGYN. So it's for me, as I have written this is thing, the glorious gender begins with the right vision. And artificial intelligence is a future and creating the future. It's not only stopping here, but it's going to create the future. So important point is what is AI? For a general OBGYN, what is artificial intelligence? So I should be able to explain myself and to my colleagues what artificial intelligence is. This is a type of digital computer that parallels the way of human brain processes information. So for example, any information which comes to our brain processes it, keep it in a mind in two ways, either in the form of memory or executing something. Same, the artificial intelligence will act like a brain and it will have a computer system. It will process all the information. Now, organization of AI is similar as neurons. It will just like all the information, all the data will be entered. It will go there. with a multiple neural nodes, therefore as a neural network. So it will network. An artificial neural network consists of dependable mathematical system that can interrupt multifactorial data. Why I feel nowadays when patient comes to us, we all say, कि सब Google से पढ़ाई करके आते हैं, सब Google से पढ़ाई करके आते हैं. But this is future, am I right? We cannot avoid it. If they come to us with all reading everything, that's good for us. At least we are also updated. They want us to be updated. They keep us updated. So the future is like that, we cannot avoid those things. So in a future, what artificial intelligence will take over from us and what artificial intelligence will give us to us. So these are the important points. So these are three things. By transmission of data forward and backward into multiple synapses, these neuron process answers, and making this multiple connection enables the computer to mimic cognitive functions. And the third point is such as the reasoning process to identify the most probable answer to the problem. What exactly we want? कि कुछ उसको डाटा उसके अंदर गया है, so at the end of the day we should know what is the probable answer of this. So it can assist in prevention, diagnosis, monitoring of the disease by using a complex algorithm. ये है, ये है, ये है, ये है, ये है. So at the end result is this. So the artificial intelligence will take over of the thing. They will have their own algorithms and they will help us to in a prevention of the thing, disease, in a diagnosis of the thing, in a monitoring of the disease and this thing. And another important AI aid in the doctors in the decision making and will help the clinicians to make appropriate and timely decisions. Because this is an artificial intelligence, see the mistakes will be very less and less because they have such a good data and everything. So the results will be there. So it's very, very good for the clinicians. I'm not going into detail, but this is artificial intelligence. When people talk about, they have an autonomous system, machine learning, deep learning, so many things are there, and that all includes into artificial intelligence. And artificial intelligence and many more things, and automation, in a next generation cloud robotics, into the controlled gaming, there is a real-time this thing, universal transmission, virtual companions, cognitive cybersecurity, 110 things are there into the artificial intelligence. But for us, we need only 4 essential core components. Number 1 is a mechanical learning, ML. Number 2, there should have a natural language processing. Number 3, it's an artificial neural network. And number 4 is a computer vision. A person like us as an OBGYN, we don't understand all 4 things. I'm sure I'm talking about and I'm learning about all this. But basically, हमको कुछ ज़्यादा इसमें समझ में minimum आता है. Still, I'm telling you, mechanical machine learning means we need a machine, we'll learn. And what they need some natural language processing, so they're having an artificial neural network. And what is the computer vision at the end? So the first thing is ML means it relies on the subtle pattern and interfaces to make future prediction. So they will have all the data and they will make the future prediction. Then the second thing is NLP is designed to understand human language because we know some language processors should be there and including the inherent speech. And ANN is inspired by the biological nervous system, comprises of many computation units and they behave like a neurons. And CV is a computer vision. It is understanding of images, videos, such as facial recognition and all technologies. So when these 4 things are included into it, we can produce many more things. So in a healthcare, how 3 things are there? Number 1, HCP facing. We will have community facing. Then we have a research and a business healthcare. So the promise of artificial intelligence in medicine is to provide composite panoramic view of individuals' medical data to improve the decision making, to avoid the errors such as misdiagnosis and unnecessary procedures, and help in ordering and interpretation of appropriate tests and a recommended treatment. This is Eric Topol. We talked about it. So why we are going into more and more and why we are so optimistic about the artificial intelligence is because we all professionals of the 50% time of is used for this professional purpose and 44 times for the personal purposes, for the leisure activity. For the whole day, average 2 hours is a very average 2 hours are spent on the internet. So these already the doctors are spending their time for the everything. So what does the digital world mean to the physician? Number 1, they use for the networking, connecting to the patients. Already we are doing it. We have a patient communication, like Shield is giving this platform. So it's a communication being given, it's a networking being given. Then peer-to-peer networking, we can network with our own peer, we can do like that. Then electronic medical record. This is going to change all the scenario of the practices nowadays, this electronic medical record, and retrieving information. So if you want to retrieve the information in what journal, what like, so all these things will be included. So what can AI help in practice? Number one, it will help in a diagnostics. Number two, it will help in a drug discovery, whatever the drug is used, kahan kaun sa lagega, and all those things. It can be used for the clinical trials. It can be used for improving the patient outcome. At the end of the day, we want patient's outcome should be the best. Then the clinical decision support, information management, and the last, this thing. But what are the barriers? Why we are not able to do it fast? Because number one, it's not an adoption issue. We are not ready for it. Then we are worried about our data. So data privacy concern is another thing. Then third is a compliance to regulations. So the stakeholders and everything not allowing to do the compliance, and the regulation is there. So that's a problem. And stakeholder complexities, which is very important. Okay, how much data we should give to the artificial intelligence, what they will do, how they will be used, how that data will be given, and how we can in future uses. So in practices, we are already using AI. Number one, we are having a smart watches. We are having a CT brain bleed diagnosis. We detect the sign of diabetic retinopathy by artificial intelligence. In ICAD, breast density biomammography is already we are doing. Zebra Medical, we are doing the coronary calcium scoring. In a Mayo's Clinic, all cervical cancer screenings are done by artificial intelligence. So now number one is community facings. Of the millennials born between the year 1982 to 2004, 50% say that they would give up their sense of smell rather than the loss of device connection. So you can understand how Ritu was worried about that her computer is hacked and all. So we can understand. So 50% of the youngsters say that they can give a sense of smell for the device of connection loss. 1/3 of them would rather have a flexible work environment, access to social media than a bigger paycheck. So they are happy with the less amount, but they want social media and everything all the time. So these are the three things which are important. Number one, authentic, available, and affordable. That should be there. And research in the business of healthcare. So artificial intelligence simplifies the lives of patients, doctors, hospital administrators by performing tasks and are typically done by humans, but in less time and at the fraction of cost. One of the world's highest growth industries, that AI sector, was valued about 600 million in the 2014 and projected to research 150 billion by 2026. So you can understand how exponential growth is going to happen into this area. And this is the business of healthcare, retail healthcare, and severe things. Now, access. There's a leverage of the digital technology to enhance access. There are purchase products. There's a taboo of infertility. So now I'm coming up to what we are doing in AI in OBGYN. So the role of AI in OBGYN, number one is a fetal heart rate monitoring. Number two is intrapartum surveillance. Number third is parturition. Number fourth is preterm labor and sonography. I'm telling you, in future, AI will take over the sonography and it will be done, and very have a good thing, that gestational diabetes mellitus, and in IVF also, and cancer screening. So these are the fields where we can say that the artificial intelligence is going to work. And the last is urogynecology. So the scopes currently are fetal rate heart monitoring, GDM, preterm labor and ultrasound, IVF, ultrasonography, gynec oncology, and parturition. Now in fetal heart rate monitoring, see how we are doing it. FHR monitoring and pregnancy surveillance. It helps the monitor for FHR during by analyzing CTG and estimate the possible outcomes. The technology will help decrease the discrepancy between the different obstetrician. Number one, more reliable, replicable output for each analysis, and ultimately reduce the perinatal and maternal complications, what we exactly want. Now, how it will be done? It can give a quantitative and a qualitative overview of baseline fetal heart rate, beat to beat, variability, and acceleration, deceleration, and intensity of the uterine contractions. So it will help. It analyzes the CTG, estimates the possible outcome, and reduce the inter and intra-observer variation. It gives more reliable and replicable output for each analysis, and it reduces the perinatal and maternal morbidity and mortality. And this is a study done by BMC Pregnancy and Childbirth. Is a big study being done of the intelligence system, support the decision making of the management of the labor using the cardiotocograph. So, but what are the limitations and what is the system 800? There is a disagreement between the specialists about the interpretation of the CTG trace, but system 800 for monitoring the fetal heart rate by detecting beat-to-beat variability, acceleration, deceleration. Now, this is the FHR, which is going to take over by the AI. Now, preterm labor. Preterm labor and AI for the sonography, mechanical learning will be there, particularly deep learning, achieved a good and excellent prediction of the perinatal outcome with asymptomatic pregnant woman. If the patient is asymptomatic, if she go into the preterm labor, that's the best thing. If the artificial intelligence will use us, and we can with the short cervical length in the second trimester. Currently, the short cervical length is the strongest risk factor for prematurity. However, many women carry on their pregnancy till term. So what the artificial intelligence will do, will therefore find out the age, hypertension, diabetes, smoker, BMI, prior preterm, what is the cervical length, if she's a drinker, will take all the input. They will do the processing of the data normalization and the feature selection. They will do the analysis. Then there will be AI algorithm. Then there will be classification. Either it's a preterm or no preterm. So the steps, firstly, the method collecting data, consulted between the physician and a data scientist. It's a universal data. Secondly, necessary to prepare and properly perform the data's anonymization and carry out the data's filtration, which consists of removing outer liners and imputing the missing values. And third thing is a proper selection of the machine learning algorithm, both classification, feature of the extraction. So a learning process should be carried out with a division into number 1 is the training, number 2 is the validation, and number 3 is the test set. So this will be going to happen. What will be the predictable labels? What is the preterm labor and the no preterm? What will be the neural network? What is the input? And basically, what are the UCSG images and how it's masking? So the combination of AI and amniotic fluid proteomics and the metabolomics in conjunction with independently with the imaging, demography also, clinical factors also to predict the perinatal outcome, and asymptomatic women with a short cervical length. So accuracy is almost 97% in predicting the PTL. So AI is going to take over this thing, and deep learning displayed a good, excellent performance of the prediction of PTL is less than 34 weeks. And delivery within 28 days and NICU admission, they can talk about. So preterm labor and AI ultrasound is an asymptomatic women with a short cervical length in a second trimester. The machine learning, particularly deep learning, is promising in predicting the neonatal outcomes. So AI is going to take it, and what will be the amniotic fluid multiomics, what is the prediction, what is the perinatal outcome. There are so many studies and things are going good with it. So we have to do the various biomarkers also with AI and studied into the amniotic fluid. These are the latest and coming up things, that is the metabolomics and proteomics to predict the possibility of the preterm labor in the patient with a short cervical length. So first is a fetal heart rate, second is a preterm labor, third is a gestational diabetes. Now how the AI is going to take the gestational habits are very simple: wearable sensor devices into the hand, smartphone apps, e-health records into data mining, then telemedicine and online communities and social media. So online calculator and the physician and patient can use for the screening. And these are again, so many studies are being done right from it's an artificial intelligence technology for the GDM screening. And the outline calculator uses the risk factors, what is the weight, blood pressure, race, ethnicity, smoking, hyperlipidemia. And it is less efficacious than standard screening options and tests available at the present. But it's gaining popularity with the hope that it may help into the lowering the cost of by this calculating risk. And studies have shown that evaluate the use of calculator to screen GDM. It's a more cost effective, less inconvenient for the patients. So another important point is the third and most important is IVF. How innovative technologies are going to help IVF into the artificial intelligence in vitro fertilization is a future fertility. See, they will do in 3 things. Number 1, in a gamete selection. Number 2, AI will be in an embryo selection. And number 3, what it should be the treatment regime. So it's a vicious circle. And they will give you the treatment regime. They will tell you what a gamete selection should be done and what are the embryo selection should be done. So these are the studies they do. They'll have all the data and everything and the things. To help the clinicians to predict the pregnancy success rates, number one, they create the hybrid intelligence model in 2011 that used data mining to integrate genetic algorithm and decision the tree making techniques that extracted information from IVF patient records. So the combining AI and X structure description, the result proved to be average and compared to the current methods that could help to select the best possible oocytes, embryos, and non-invasively. Basically, that's another important and objectively. So this has the big genetic algorithm and decision training. An ANN system using the learning vectors, standard parameters, enhancing the predicting values of IVF outcome, and it can identify the most viable oocytes and what are the best embryos. So another studies for that being done, and these are the third thing. Number 4 is ovarian carcinoma. That's another important for the AI, because cancer screening, they have a software that predict the prognosis of the patient, ovarian cancer precisely, and predict the most effective treatment according to the diagnosis of each patient. So it's the most targeted therapies, very minimum therapies, and cervical precancer patient can be outperformed. Human extracts interpreting the colposcopic image in a lesser cost. So colposcopy in a data-wise, give the artificial intelligence cervical cancer, predict the values of many more things of the, and we can predict the ovarian cancer. So screening of ovarian cancer is another important point for prediction and the prognosis of the ovarian cancer by neural network model, which is currently being used, and reported ANN was able to find it out 97% accuracy. So this is another prognostic and predictive value studies being done by the surgical oncology, and that is there. So the software was created and predict the prognosis of patients with the ovarian cancer precisely, help the predicting the most effective treatment according to this thing. Now, researchers at Brigham and the Women Hospital of the Dana-Farber Cancer Institute have been using AI and manipulate the large amount of microRNA data to develop models, and they can potentially diagnose early ovarian cancers. So digital technology is about the convergence of information and communication, and the above study AI system was able to read the information, detect the errors, and large trials evaluating the AI assist prediction, deciding the best management option. At the end of the day, what we want a proper diagnosis, we want a proper treatment, we should be able to manage the patient, and the best outcome should be there. In urogynecology also, the AI has got the role, because they can use a wearable devices linked with AI system. Patient's condition can be monitored and managed. And then the third point is virtual visits allow the follow-up. So these are the another algorithm, how the input will be and what will be the output. Input, they want what is the location of pelvic floor, urethra, what is the age of the patient, what is the demographics, what is the initial 2D scan, what is the 3D scan. Now what they want, what is the urethral pressure, what is the bladder pressure, what is the severity of the prolapse, what is the possible intervention method and simulation options, and these are the things. So what the mechanical learning time and AI will do, they will supervise the semi and supervise the unsupervised things will be there. They will find out the AI in the diagnosis of the measurement, then AI in the prognosis and the prediction, and AI for the surgery. Now the last and most important is the parturition. This is going to change the scenario of this country as well as all over the world. Is a gene array profiling the myometric events to achieve the better comprehension of the molecular mechanism to regulate labor. It's that the staff is going to sit outside and they are going to find it out how the labor is going, when the patient is going to deliver, what will be the alert signs, when to interfere, when to refer, when to transfer the patient. Everything will be done by sitting just outside. And because there's a densely connected labor force and there are the legal assistance also, and everything, social skills and everything will be taken care. So could achieve the successful labor outcomes in the mother. So we always overestimate the change that will occur in next 2 years, but we always underestimate the change that will occur in next 10 years, because I'm just giving you one example. 7 years back, our city Indore, it was I think one of the dirtiest city of the country. But in 6 years, now we are consecutively on the top position as a clean city of India. And why it's possible? Because we underestimated the change will occur in next few years. And all of us are responsible to make the city clean. So in a similar manner, these all things are important. So the take-home message is AI has a promising future, overcoming diagnostic challenges and improving the treated modalities. The further developments of AI will continue. Clinician must embrace them and when necessary, recognize its advantage, drawbacks, continuing to provide best patient care. And AI is not meant to replace practitioners. That's the most important point. They will need us, but to serve as an adjunct in decision-making. That's another important point. Another take-home message is AI can be used as a promising tool for the obstetrics and gynec as an approach to resolve several long-standing challenges. AI assists the clinician in decision-making in various case scenarios, minimizing the inter- and intra-observer variations. And there is a need of a further research in the field of AI to make it more promising for the OBGYN. That's more important. So every member matters. That's my point. So thank you so much for giving me the chance, Ritu. I always enjoy it. And you always give me the subject of my choice. So I'm really blessed. Thank you so much for the patient listen.
Thank you, madam. Thank you for such an elaborate lecture. I think this is a very new concept. And so each and every one of us has got some new points to understand. Dr. Nishant, are you there?
Yes, ma'am.
Yeah, please check for the questions.
Yes, ma'am. So, delegates, if you have any questions, you can post your questions in this chat box. As I cannot see any questions right now.
Because this is a very good topic.
Very good topic, yes.
Yeah. And very new topic. So, madam always do some new things that I know. And madam, thank you so much. I know your schedule is very hectic. You are traveling from one end to the other end. Even though you accepted my invitation and enlighten all of us with your knowledge, I am really grateful to you.
One question is from my end.
I will never lose a chance, Ritu, whenever to interconnect with you.
How much is the possibility of getting this AI well established in India in our field of obstetrics?
Number one, fetal heart monitoring very soon.
Yes.
Very soon. Number two, diagnosis of cervical cancer, because we have a lot much colposcopy data. Am I right?
Yes.
So all the data will be included. Just to put a thing, AI will give the answer. So number two is very easy. Number three, GDM we are taking up. That's a taking up because kya chahiye GDM? We need a watch, we need a thoda sa wo. It will give prediction and also the GDM also gone. Then the preterm labor, you can say it's also doing best nowadays with the preterm labors because prediction with the cervical length, because these are going to take over the all sonography very soon. I'm telling you, all the data they will get, ye hai, they will have all the points. And this is the answer. And now you treat and diagnose. So sonography, mammography, many more things. All the radiological things are going to taken over by the AI very soon. Then we are waiting for, you say, labor room assessment. Hum dusre kamre mein baithe and some monitoring is going on. And how we can use that's a future. I think that will be, I think within 10 years, 7 years. That's what I'm saying. Ki prediction nahi hai uska kitne jaldi aa jayega. It will come fast. It will come fast. What I feel.
Thank you, ma'am. Thank you, ma'am.
Thank you. Thank you, madam.
Have a good day. Can I go?
Yes, ma'am. Yes, ma'am. Thank you so much.
Thank you so much.
So friends, stay tuned with us. On next Thursday, we are having Dr. Nasreen Sheikh madam from the Bangladesh. She is going to discuss with us the osteoporosis and the bone health, osteoporosis and bone health in the menopausal patients. So with this, we will wind off today. Before I wind off, our Dr. Nishant is getting married on 29th. So Nishant, a big congratulations to you. We all are a part of one family. Thank you, Sahiti. Thank you, Chitra. Thank you, Dr. Prachi. Thank you, team.
Thank you, ma'am.
Thank you, ma'am.